Senators Lopez, Pinto, and Cedillo Lopez, thank you for sticking around and welcome back. Since Roe v. Wade fell 4 years ago, New Mexico has been seen as a sanctuary for reproductive health care. Senator Pinto, how difficult is it for Indigenous communities, for Indigenous women in our state to access reproductive health care?
We don't have a women's health facility within our area, within that region. We have to come all the way into Albuquerque. I think that's one of the goals, hopefully with the new IHS building, that will have some kind of little bit of a center in that sense for our children and our women. Because that general health care, especially when it comes to the child and the mother, the closer you can stay to home, I think it's very, the doctors and those that want to work in our area, they care a lot. There's some of them that have been there for years, and they're really vested within the community, and they stay there. And when you come out of from our area, sometimes it's not as great. So I hope we get a little bit better access.
And did the Dobbs decision change that landscape, or are these barriers existed since way back in the 1970s?
I think within the rules and guidelines of IHS, there are some changes that need to be made, because there are some guidelines there that don't allow certain things to happen. I know one of the things, for example, within dental, is they won't allow the gas to be used. Although that's probably one of the best humane ways for our children to, get dental care. But there are some other things that I'm not sure, because I only know about IHS, the way I get health care, the way my sisters get health care, and the stories we share, especially when you talk about birth control. I know there were times where there was the implants that were pushed in a way to some of the women in my generation, and it didn't seem like there was a follow-up on it, where it got embedded. Different things.
Oh my gosh.
And then they go back, and there's problems with their reproductive stuff, and then they got to go in and practically almost do surgery to take it out. I mean, it just gets really very risky when there's no follow-up. And I'm very curious of why they implement it just to pay the pharmaceutical company, but the follow-up and the following care does not happen. It needs to happen.
Yeah, maybe the memorial needs to be expanded.
Well, what I anticipate too is that after we have an initial, organization, and we are able to get some of the professionals who can come to sign on, this, I think, is going to grow a little bit more than what even, I think, the initial wording that we have in the memorial at this point. Because there's so much more than just anything that deals with reproductive justice. Right. And as you know, that's expensive. It's pretty big, but necessary.
Because it's not only reproductive justice, but it's forced sterilization, but also experimentation on women's bodies, like using certain high levels of birth control with high levels of the hormones, and then realizing decades later that they didn't need so much, yet they had experimented on women's bodies for decades, and mainly bodies of color. That's what's so upsetting about the Depo-Provera in Indian country.
Yeah, very curious.
That's definitely devastating to hear. And with Senate Memorial 14, it'll also create a record of survivor testimony. Now, these are tragic personal histories. We've already heard some of it right now, but Senator Cedillo Lopez, how do you see survivor testimony informing your work going forward?
Well, I think it's the most important thing, because otherwise we don't have the records. So if survivors don't come forward and tell us what they've experienced, then that it gets pushed under the rug. We're not aware of it. There's no reparations for it. There's no, I can imagine how devastating it was for these women who were sterilized without their consent to find out that they couldn't have children. When in the culture, having children is just one of the most important things. And so just that emotional harm, I think that this issue is so important for so many ways, and I think we should continue to focus on it.
So the physical impact report for this memorial notes that it might be difficult to obtain information from the Indian Health Services. As Senator Lopez, what power does this state have to get these information?
Well, part of it, of course, too, is for us even just to begin this process, to begin the conversation. But I know that there's been some conversation happening behind the scenes already. We need to be able to work with our congressional representatives, of course, because they too have an actual access to the Department of Interior and other. So we will be outreaching to our 5 elected congressional representatives. And also to, we have a person who lives in our state who served as the secretary of the Department of Interior, and I believe in conversations with her that we can also learn more about the, what goes on within the department, and maybe some more contacts and persons that we can begin to do some, information requests and figure out how we can do. I know that in one of our committee meetings, Dr. Begay also gave some information as to how she was impacted, but she's been in the system too, and I believe she and some of her other professional, colleagues, of course, can help guide us, and those are part of the persons, I believe, that as we put together this commission, this group of persons, to lay out the plan.
And do we know if the legislature has subpoena power?
The legislature does have subpoena power, but that is very limited at this point. But we just had a commission that was put together by the House of Representatives dealing with Jeffrey Epstein and such, and they did, and were given subpoena power. So if that's an outcome it's necessary from this initial meeting, we can propose that to the legislature too. So there's always an option on the table.
And this study seems to be the first domino. Senator Pinto, what's the end goal here? Does that look like a physical memorial, a state apology, possibly reparations for survivors?
I think the victims now, it's more about acknowledging, and I think that's where the apology is. It's just that first step. When you talk about getting to the next atonement step, just to get things rolling, it's that acknowledgement, because the denial or just not even saying anything is, we know that's not a way to move things forward. So I'm hoping we actually get a little bit more on it for those that have been victims of it.
So these findings are meant to be reported to the governor by the end of 2027. Senator Cedillo Lopez, if you run out of time and there's still so much more work to do, how will you do it?
I think we could, one of the findings can be that we need more time, because these records, we've been talking a lot about like BIA records, different records that we need to see the scope of it, so we could talk about numbers, but also the victim stories will guide us. I'm guessing that we're going to find victims in a lot of different places, including urban hospitals. And so I think that when we know the scope of the problem, we can, as part of the memorial, extend it for more time, and subpoena power is going to be very important so that we can, I'm sure that some of the hospitals are not going to want to share their records, and so we may have to go that route. But I'm hoping that as soon as we get the publicity we need, we're seeing this in the Epstein, what they call the Truth Commission. We're seeing people come forward that nobody was, or at least the system didn't seem to be aware of. At least the Department of Justice allegedly wasn't aware of it. And I think that's going to happen here too.
Again, we're the first in the country to have this. And what part of our conversations have been too is this may have more of a, I call it a snowball effect, right? Where it continues to grow and other states may follow, right, within the indigenous communities across the country, working with their local elected officials in the state, that once it grows, I believe that there's going to be more of a push. So it's not just New Mexico asking, but it will be other states that will mirror what we're doing too. And part of that, I think, is there's, through the United Nations, of course, they're supportive of this endeavor, but there's also the repertoire who's willing to come to New Mexico, and he's like the one of the persons in the chain of command at the UN who's willing to come to New Mexico and bring, I think the that brings in itself its own media and exposure for the country and the world about what we're doing here. So that I know it's on the list to happen.
Well, I think with any of our indigenous communities, any of the issues don't seem to be solved very quickly. It seems to take years. The boarding school, MMIP, and I think this is going to be one of them too.
And do we know of any laws that might come out of this?
Well, I think one thing that I read in some other articles was that there is no legislation that kind of says it's illegal to have coerced or forced sterilization. But there's malpractice, and yet we've chipped away a little bit on that. So we'll see.
I could see extending the statute of limitations like we did for sexual assault and rape, or sexual assault of children and rape of adults. I could see an extension of the statute of limitations because a lot of these happened a long time ago. And so there's issues of culpability and issues of liability, issues of atonement, reparations. Maybe we don't extend the statute of limitations, but there's reparations offered, or, who knows. I think part of it is involving the people affected and involving as many communities as possible, because it's outrageous. I mean, this is just, like you said, tort liability. They're not supposed to do this without informed consent. That is wrong. It is an automatic malpractice action. But we're not, because some of these cases are so old, it's kind of a loss of justice, which when the case is no longer viable as a medical malpractice case, and it was the government that did it, another alternative is reparations.
And you'll remember here in the state, in New Mexico, we've also, during my tenure in the legislature, we have had legislation introduced, similar to what you mentioned, Senator Cedillo Lopez, about women who are on public assistance, or if they have been found to, have drugs in their system when they've given birth, for them to be forcibly sterilized. And we've had legislation. Thank goodness we've killed those bills, quote unquote, in the legislature. But it's still part of the conversations that we're having. And I believe that it's dangerous for us to continue to even have that. But as I've mentioned previously in other conversations, it's another form of eugenics. And it's not just in this country, but as I've learned in listening to the other ladies, is that it's worldwide of what they have done to our indigenous sisters around the world and continue to do it. So it's not something that was the practice in the past, but it's currently happening as we speak.
I'm curious to see what other states still have that kind of legislation in their statutes.
It is
So
deplorable.
disgusting.
But uranium is one of the issues too. That's been very
Sterilized
old
women.
and
Yes, that was another way.
so interesting.
Yes.
Well, Senators, thank you so much for your time.
Thank you. Thank you for taking an interest.
Yes.
Thank you too.